Benazepril, what is it? How does it work? The formula for benazepril is C24H28N2O5. The brand name for benazepril is Lutensin. Benazepril is used to treat high blood pressure for individuals who suffer from it. It treats hypertension in the body by relaxing the blood vessels so the blood can flow more smoothly. Benazepril also reduces the count of white blood cells in the body, risking patients' chance of getting more infections. If this condition is not seen by a doctor or is left untreated, it can result in strokes, kidney problems, and heart attacks. Signs that can help an individual determine if they're experiencing high blood pressure are fatigue, abdominal pain, severe headaches, difficulty breathing, and many more. One day, Mary was experiencing signs of high blood pressure, so she goes to Mr. Samosa's clinic to get her blood pressure checked. The doctor finally arrives and tells Mary that they're going to start with checking her heartbeat. After checking her heartbeat, Dr. Samosa determines that Mary has an irregular heartbeat. He begins to check her blood pressure level and finds out that she has hypertension. After taking some precautions and asking if she's pregnant or allergic to any medication, he prescribes her with a 5 mg benazepril, which she has to take twice a day.
Once known, if patient is not allergic to ACE inhibitors or pregnant, doctor can prescribe the standard amount of benazepril, which is 10 mg. Unless the patient is being prescribed a diuretic, which is a water pill, then the amount of benazepril given is 5 mg a day. The numbers can change, for example, increased by 20 to 40 mg maximum once a day or divided and then given twice. This may take 2 weeks to see full effect of the medication. Benazepril is a carboxyl-containing angiotensin-converting enzyme, or also called ACE inhibitor. Benazepril turns into its active form of benazeprilat to block angiotensin 1 from converting into angiotensin 2. As the action of angiotensin 2 is to increase the blood pressure by constricting the blood vessels, which has to be prevented in order for vasodilation.
Benazepril is swallowed in through the mouth and goes down the esophagus. First region the medication reaches before going into the stomach is the pharynx, which is a region between the mouth and esophagus when swallowing takes place. And this drug undergoes 4 different stages: absorption, distribution, metabolism, and excretion. Absorption usually occurs in the small intestine. While it goes down the esophagus, it is then absorbed through the stomach and the small intestine. Surface is increased by finger-like projections called villi. The villi are lined with columnar cells which are coated with microvilli. Absorption takes place across the walls of each villus. From there it then passes into the bloodstream and travels to the liver, the hepatic portal vein before reaching the brain. The liver then transports these drug molecules in the blood to the hepatic veins, which then lead to the vena cava of the heart. Some parts of the medication then makes its way to the bloodstreams through the epithelial tissues. Once benazepril enters the bloodstream, the heart pumps the blood throughout the body, carrying the drug with it. This is how benazepril will reach the brain. The drug can make its way to the brain or spinal cord, also known as the central nervous system. It must pass through a system of tightly woven capillaries that prevent poisoning or dangerous substances from reaching the brain.
What occurs next is metabolism. After a medicine has been distributed throughout the body and has done its job, the drug is broken down or metabolized. It is then carried to the liver. There, substances are broken, cut apart, stuck together, and transferred by proteins called enzymes. Many of the products that are broken down by the enzymes are less chemically active than the original molecule. At last, excretion occurs. Inactive drug undergoes the final stage of its time in the body, excretion. This removal happens via the urine or feces. By measuring the amount of drug in urine as well as in blood, clinical pharmacologists can calculate how a person is processing a drug, perhaps resulting in a change to the prescribed dose or even the medicine. For example, if the drug is being eliminated relatively quickly, a higher dose may be needed.